requesting a couple of different things. So with that said, just from a context perspective, I'm not sure if you have any specific questions related to the report or the letter that I can help with right off the bat.
This is, oh, you go ahead. Okay, well, this is Lowell from Spectrum News. I saw at the very top of the letter, you said you're requesting more clarity from the state on metrics for reopening. What exactly do you mean when you talk about metrics? I know about 2 weeks ago, there was debate between school systems and the Monroe County, Dr. Michael Mendoza about metrics on school reopening. So what are you requesting from the governor?
We're requesting, I mean, it sounds overly simplistic, but just the idea of some clarity around what metrics and what levels we need to be at. So the CDC, as you know, recently updated their guidance. There's really specific metrics in there, but yet in New York State Department of Health, it's not quite as clear in terms of helping us to determine if we've reached a threshold with a particular metric and if that means we can reopen. So we're looking for some guidance and more specificity there. And then we're also looking for, one of the other requests in the letter was some guidance related to some of our end of the year events. So we have a ton of things coming up for our kids and families that are celebratory and really, you know, once in a lifetime things that we want to make sure that we're planning and doing our due diligence with. So we've asked for some guidance related to that, things like graduations, proms, etc., that we don't have a lot of clarity on right now. So those are the two major pieces within that. And that's also consistent with a lot of the different school superintendents and what different areas have asked for.
Kathleen, it's Jen Lukey from News 10. I'm wondering, did you ever hear back anything from the governor or the state health department on your first letter about spacing in schools? And I guess for you, you know, there's so, I know you know, there seems to be a parent group in every district now really pushing hard for full-time 5 days back to school. So what is it, in your opinion, that needs to happen for that to become a reality? And do you not see that happening until the start of next school year?
Yeah, you know, so I'm going to go back, I'm going to try to anchor back into this Finger Lake group as much as possible, because I think the main thing that we want is we want to ensure the safety of our children. And what we're asking for, and what I asked for, and what me and my board president and I asked for, was clear metrics from the state in terms of what would deem us safe to open. And if we could get to those metrics, so basically we would be saying that there was such a low prevalence of this virus and spread in our community that we felt like it's safe for us to open schools. We would also need the relief of the 6-foot guidance. So that's, like, from a Greece perspective, what we were asking for and what we would need to be able to open. And that is what we're hoping for in terms of the Department of Health, the New York State Department of Health, which is who we follow and who we're bound to in terms of regulation, that they would give us some relief related to that, or some clear metrics in terms of if you reach this point, then you can relieve yourself of the 6-foot distance piece. So we don't want to do it willy-nilly. We want it to make sense, and we want it to be safe for kids. And, you know, we have parents in all communities who want their kids back in school and are struggling because what we're living through now is such an inconsistent time. So, you know, I think that the reason people are frustrated is it's now we're approaching a year, and there's a lot of inconsistencies across the board, not just in schools, but really within our community around how we're living. That make it frustrating for people. So we certainly understand that. And I think for us as educators and as leaders in the community, we want to ensure, the reason we ask for the criteria is because that gives us the base to know that, yes, we're safe. Then I can do this with confidence. I can open our schools and welcome all of our kids back and be happy to do that. We just want to ensure that we have both. The document itself, just so you know, it's not a really lengthy document. It's highlighting some key areas that were worked on. So I just, having sat on this committee throughout the year, I want to make sure that I at least highlight some of the different groups that were working and that have been working and continue to do so. So there was a resource hub created by a group of us, which has a lot of resources that there's hundreds of people going to access things like some mental health resources and supports. child care resources and supports. So things like that. That's one domain that had been working. There's a different group that was working more medically speaking. So really public health and healthcare providers along with educators around interpretation of things like masking, social distancing, and things like that. Which was, I will say, an enormous task. So that group was meeting literally weekly this whole year because every single thing that we've done to keep kids in school has been a huge effort. And there's been a lot of work behind how to do that right and how to make sure that we're all on the same page. So that group has worked incredibly hard related to that work. And then there was also a communications group that was looking at how do we message things? How do we communicate in ways that are clear to the public so that we're not speaking in jargon and so that we're all, whether it be through some of the icons that they created and some of the publications to ensure that there was some consistency across the community. And I think it's huge because I've talked to 3 different superintendents from other areas in New York State who have not had that same amount of collaboration in their area or in their region. And things don't feel, I guess I should say things from their perspective felt pretty negative and that there was a lot of finger pointing where I haven't felt that here in our community because I think this group really worked to sort of combine and build a lot of collaboration among all those groups, which was really important.
So I know that we've spoken a lot about the 6-foot distancing, and that obviously seems to be the biggest barrier, but I'm just curious if whether through this report or just in general, if there's any other barriers that have come up to reopen 5 days a week aside from that 6 foot.
That is really the biggest problem, that and transportation, but it's really sort of the same thing. It's that idea of distancing on a bus. And how that we would struggle with that. There are a lot of things. So I know that we've really started to think about how can we open for the 4th quarter? What would it take? I want to be ready. So the minute that there's a metric given and we can meet that, I want to be immediately ready. I don't want to be holding that up. Some of the things that are a struggle within our communities or in our school communities are things that we have got furniture in storage because we've had to move things out to make the physical environment work. We have schedules that may need to be redone. We have bus routing that will need to be redone. There's a lot of work on the other end of it for us as educators, but work that we're really happy to do as long as we get the go ahead in terms of whatever that metric is going to be that we need to meet in order to be able to do that, to get the go ahead to be able to do that. So nothing huge. I mean, that foot piece is really the one that prevents us at this point of more kids coming back because we have all the other protocols pretty well set.
Hi, this is Jane from 13 WHAM News. I believe the governor said that he would like teachers to be vaccinated in order to return to school fully. I was wondering what the amount of staff is in the Grace School District, how many have been vaccinated, if you have that rate, and what the school is doing to improve that rate.
Yeah. We're working really hard, and again, this is a great example of collaboration within the county around trying to increase the number of not only our teachers, but also our school staff around being vaccinated because I would say my teachers are important, so are my bus drivers, so are my lunch monitors, and all of those people. So right now, we're all in the process of running a survey in a way to find out what our exact percentage is in each of our districts. So for example, we put one out earlier this week. We don't have everyone who's replied yet, so my data isn't complete at this moment. But of the people that have reported, we're at about 60%. Now that could change because like I said, my data is not complete at this point, but I know that all of us collectively are working on making sure that we have an accurate number of our teachers and our educators to know and have some confidence in terms of where we are. The piece that we're doing, we're working really collaboratively with the county around helping to get those vaccinations scheduled. So this sounds crazy, but we literally have worked with Monroe County around just getting a certain amount of spots each week, where then what we do and what I can do in my own district now or educate or bus drivers and actually we actually take care of making their appointments for them and letting them know so that they can get them. I use some of the examples. We have some older bus drivers who don't feel as adept with their smartphones and with their computers. So we've been doing that for them and letting them know. And for them, it's been a huge barrier because trying to get into some of the links, as you know, around the county requires a lot of time and sort of tech savviness that they may be struggling with. So like I said, just last week, we got about 80 people appointments, and that was due to a very small group of people scheduling and just doing that for one another. And then the other thing that is happening, which I think is pretty great in terms of a story, is just the amount of younger staff members here who are looking out for their colleagues and checking to see who has appointments and then helping them with making the appointments. So I was watching a staff member earlier today help one of our people down in our registration office with getting her appointment, and they were successful in getting that done. So I think there's countywide efforts, and then there's individual school and district efforts around just knowing that this is important and wanting to make sure people are healthy and safe.
I'll go again. So I'm wondering, are you, two questions really, with the vaccination of the teachers, I know that there has been some talk, initially the governor wanted them starting to be reported this week, then he sort of delayed that. Are you feeling any pushback from staff willing to even provide you with that information?
So you know that was an executive order that came out and then it was taken back. So, you know, I think that anytime you get into personal information, I mean, we are such a data private world that there are some people who don't care to share. So even with the survey that we put out here in Greece, one of the questions was, you know, if they had an appointment to be vaccinated, if they were fully vaccinated. And then one of the options was, I would prefer not to share. So we're allowing and giving people that right to not share that. And with the executive order being rescinded, that makes it difficult to sort of press people on giving all of that information.
And then I just wondered, budget-wise, you know, I saw some tweets from some other superintendents that there is no additional money in the upcoming budgets to sort of either transform spaces or assess students on how this pandemic has impacted them when you do get them back in front of you. Obviously, we have the question about standardized tests that are still sort of out there as far as how that's going to happen. So, I mean, just from a monetary standpoint, and probably you can only speak for your district, but, you know, sort of how are you coping with all of the additional resources that are needed, one, to get schools ready to reopen 5 days a week, but then two, sort of to assess your students and the damage that this year in a pandemic has caused?
So I'll just talk, I mean, I'll rant for a moment about budget because, you know, some of my colleagues have said it more eloquently, but the amount of money, new money, is non-existent. So when you're talking about state aid being flat and all of our expenses typically going up, we're struggling right now to think about the budget year coming, you know, ahead. And at the same time, there's a general wonder from our community around, well, you haven't been in school full time, haven't you saved money? So what we've been really working on trying to do is make sure people understand that while we might not have all of our kids in school every day, all of our kids are learning every day. And so nothing has changed in terms of our staffing requirements. Nothing has changed in terms of we are still running buses, we're still running food service, we're still running all of these, the same operations that we were when kids are in full time every day like they were last year. So there hasn't been any savings. Just want to make sure people understand that. And there's been really significant costs. Like we're in the millions in terms of what we've spent for PPE and other things that the pandemic has cost us as a district. So while we're trying to be incredibly responsible and really fiscally prudent, that is the difficult task right now. And then on top of that, just people being angry because they do want their children in school. And the school budget is one place that people do, everyone gets to vote. So we're wanting to just make sure people understand really the entirety of that and the challenges behind all that goes into constructing the budget and managing that. In terms of standardized testing, I mean, there's a lot to be seen there. There's a lot of work that goes on day to day with teachers in terms of what they're learning about kids. So I would say any day I'd put up some of our teachers' summative assessments and things that they do on a regular basis up against any state test, in terms of them really knowing what our kids know and are able to do, and then also really using that plan for subsequent years. Right now we're looking at internal assessments that we use to even drive how we can do some credit recovery between now and the end of the year, and then how we're framing our summer programs. So there's a lot of really intentional work that our teachers are doing right now, just based on what they know the kids maybe haven't covered as deeply as they wanted, or maybe didn't master like they wanted. So they're being really realistic about that, but also being very intentional about planning programs for spring and summer to help catch those kids back up.
Do you see school reopening fully, realistically, that happening this year?
I really, so I say, and I may be a Pollyanna and I may be too optimistic, but I want my kids back fourth quarter. I want all of them back. I think that there would be such a huge, I think it would be a huge lift, but I think it would be a gigantic relief for kids, for families, for teachers eventually. I mean, I think there's some stress involved there, but if we could get everyone back for the fourth quarter and just have some normalcy before we leave for summer, I think that it would do wonders for everybody's mental health, emotional health, and even just from a learning perspective. If I could take advantage of 10 weeks of everybody every day, I would gladly do that. So yes, I'm really optimistic for that. I think, you know, for me, I look at numbers. I think the past week was a little disappointing to me because I wanted to see that number continue to go down even more in terms of cases. That was what I was hopeful for, but overall the trajectory is good. So I'm going to plan in the most optimistic way possible.
I'm curious if you have any idea of what percentage of families would want their kids back in person. I know a lot of districts have done surveys. Did you do that in Greece? Do you know how many would return?
We don't know exactly right now. We've got one going out this week. So, and I know a lot of districts have put something out either this week or maybe at the end of last week. So we're all trying to get a gauge on that in terms of, because you have everybody in different situations. You have some people who are fully remote who, if we are back 4 or 5 days a week, they're going to really desperately want their kids to be back. And then you have other families who, with so many kids going back to school, may feel uncomfortable and might want to divert or change to a remote model. So that's exactly what we're trying to gauge and plan for. And that's where, you know, the complexity of opening and layering opening in such a way, it's difficult. There's a lot to work on and plan for.
If you all were given the go ahead for a fourth quarter reopening, so to speak, when would that potentially start for you all?
I think the beginning of the fourth quarter is like April 16th or 19th. So, and I say that it's important to think about that, because for us to be able to be ready for the beginning of April or mid-April timeframe, we're planning now. There's no way, I mean, people think if we get the green light tomorrow that I could open on Monday. There's no way that could happen. I mean, when I say to you, like, we have 30 trailers full of furniture, we have you know, scheduling changes, routing things. There's so much to do that's going to really take people, districts, probably a good month if we're starting now thinking about that to be ready for that April deadline.
I know you said you didn't receive a response back from the state on that first letter. What's your goal in the second letter on how you can get some type of response back from the state when you could possibly know, hey, we could potentially start in April, or it's a no-go?
Yeah. Well, I mean, I think so. We're using that because it's a natural time frame. It's the beginning of the fourth quarter. Nothing says that if we got to go ahead a little later that we couldn't start a little bit later. I think we just like to think about it relative to the quarters in school and what makes the most sense from a learning perspective. But you know, I think one of the goals around the Finger Lakes group is we're a larger group, and we're comprised of such differing stakeholders that we're hoping that will also maybe wield a bit more power. So me and my board president are nice. But when I look at this group, we've got public health officials, we've got government officials, we've got parents, we've got other educators, all part of this Finger Lakes group that has been really working in a really collaborative, positive way throughout this entire year, who've now really agreed upon a letter that we're sending to the governor. So my hope is that just the collective efforts and the people involved in that and the organizations involved in that will maybe, I guess, push that advocacy a little bit stronger.
Kathleen, and do you have a copy of, is this letter attached somewhere? I don't think I have that. And you said you were asking for some specifics about graduations, proms, things like that. I mean, if you look at the state's guidelines for wedding receptions, like dancing has special squares and things like that. I mean, I know you guys want that to happen, but like, do you have the resources to be like manning prom? Do you think it means that much to the kids probably that you'd be willing to sort of jump through some hoops to make this happen for them?
I think we would absolutely jump through hoops. I think for us, the struggle is a wedding, and this is where the sort of annoying part of how everything gets defined. A wedding is different from a prom. So I can't necessarily just take even those regulations at this point and apply them for sure. Like that's what we're like wanting is, are we going off of wedding guidelines, or can we have any other relief, or, those are the kinds of things that we're looking for more specificity on, so that we can actually begin the planning, because we do have people that are willing to do the work. Our high school principals care deeply for our kids and families, and they are the ones as a group, interestingly as a unit, even last month had reached out to us around they wanted to advocate more around how can we get clearer guidance so that we can begin planning these, because it means so much to our kids and our families, and they want to be able to support and really dig in and do the work with them. So I guess to answer your question, yes, we have the people who would do the work. I think even if it had to look a little bit different, they'd be okay with it. They just want to be able to plan and have certainty that they're going to be able to follow through. So I would say, I guess the only thing I would ask, I know a lot of the questions always lead to reopening and the specifics that we're struggling with and that we're hearing a lot about from our communities, but I just want to make sure that kudos and thanks get brought to that Finger Lakes Reopening Task Force, because like I said, there are a group of about 40 individuals and groups who've been meeting weekly since the beginning of this pandemic. And probably the biggest achievement that they would say and that we would say as a group is that we have been able to open schools, and we've been able to keep our schools open here in the area that encompasses these 13 counties with really, really low transmission rates and a lot of success. And as much as I know we want to get more kids back in school, that is a huge achievement when you look across the nation and the entire state in terms of what we've been able to achieve. And that I think is in large part to the people that have been serving on these committees and trying to help move this work and stay positive and stay united as an area and as a region. So I just wanted to make sure I thank them for all that work.
One quick question. Do you all have any new goals that you're looking forward to with this task force? Anything you have your eyes on for the future?
I think the groups, the groups are pretty consistent. I think the group that will probably spend the most amount of time with having to pivot a bit, and I hate that word, but the group that's working on sort of the medical guidance, if we get changes to the New York State Department of Health, that group has been instrumental in terms of helping us to interpret and then also helping us to make sure that we're applying that appropriately in our schools. So I think it's not necessarily a new goal, but I think if we are to be able to get some updated guidance from the Department of Health, and then that group is going to be fast at work, really kind of looking at what does that mean, boots on the ground at a school level, and then how to help us and support us with that. And that's what they've been doing all along. Thank you, everybody.
Thank you so
Thank
much.
you.
Thank you.